Welcome back to your hour. Joining us now is Jamie Whitfield from Recovery Matters, and you actually have a different job than what you had when you were here.
Right.
You work for a treatment facility. Can you
Yes.
tell us about it?
Yes. I work for Mirrors, the Reflections location here in Wichita, 3820 North Tobin. And I just wanted to talk about this new program that we just recently opened, December 1st. We are currently providing services for adolescent males, 16 to 17 years old, that are suffering from active addiction. Like I said, it's new, it's evidence-based program. I have immediate openings. If there's some teens out there that are needing some help, you can give me a call anytime, Monday through Friday at 316-634-3954. And I'd be more than happy to assist with that. It's just it's a blessing to be a part of something like this, to be able to be
Yeah.
of service to the teens. They also have an adult side, and so, with it, branching out to be able to reach out to our kids,
Right,
because
yeah.
our kids are out here, there are kids out here suffering from addiction.
And if we can catch them when they're younger, maybe we can avoid having them
Right.
be
It
have
doesn't
a
have to be a lifelong, process of just that's all is addiction. I feel that's why I feel like it's such a blessing for me to be a part of their recovery and them being a part of my own at their age. They teach me things too daily. And so it's just a beautiful thing for, are they there by choice? Not really. But the fact of the matter is that might be day one, and on day five they're wanting to be there.
yeah.
And then day 6 or 7 you see that light come on. And so hopefully we're able to give them, we're providing them with the tools that, if you take them and utilize them, you'll have a fighting chance to stay clean.
How long are they typically there?
It's a 28-day program.
Okay.
For the teens. And so after that, we, provide them with, after, outpatient services.
Sure.
And so I remember mine was, a form, it was intensive. So I went 3 times a week, but that was probably the best thing that happened to me as well.
Sure.
It just provides more tools to be able to, figure out them triggers, just stay amongst people that are trying to, strive for the same purpose of staying clean. I think that's important. Is who the company you keep is vital to
Sure.
your recovery.
Absolutely.
And so I feel like it's a good thing to participate in your recovery and participate in the outpatient services that they, offer after you get done with the inpatient. And so, just to continue adding to your tool belt. It's very vital that you can keep your mind open at all times throughout. I mean, even if you're not in recovery, I think it just makes a person a little better when they can just keep an open mind about everything.
Sure.
Because if we're walking around here with our mind closed, we're never going to learn anything new, because we're going to think we know everything. And if we keep our minds open, then I learn something new every day, because my mind is fully open and willing to take new things in.
Yeah.
And so I never run around thinking I got this with my own recovery. No, I don't have anything. I have an open mind to obtain more information and education. That's my biggest thing too, is people need to educate themselves about the disease of addiction. Even for me as the addict, when I started educating myself about what I'm battling every day, it makes sense to educate yourself. Just like if, you have diabetes, you educate yourself on
Yeah.
what you have. And so I think it's important, even for the parents of the children, to educate themselves. Because sometimes, on that other side, I hear certain things that I'm just like, man, if they had some education, they probably wouldn't be talking to their child like that. They would have a better understanding, and so it's kind of hard to sit there. And so I push the education, the truth about drugs, the truth about addiction, just educate yourself, even educating yourself about MAT services, medication assisted therapy. At one point, I I was one of them people that stereotyped and like, oh, that's not a recovery program because they're just using one thing to not use another drug, and that's not the case. It does assist with the withdrawal symptoms.
Kind
It
of
does,
a weaning off.
yes,
Yeah.
and just because somebody's recovery doesn't look like I want it to look like for them, that doesn't mean it's wrong.
Yeah.
You know, and so when I kind of got out of that, you know, it really opened my mind to even MAT services that are, you know, offered out here.
So if someone wants to come to Mirrors, well, in fact, let me ask you this. How do you get your patients there? Are they referred to you?
Typically-
Can they refer themselves?
Yes, yes.
Okay.
Typically, I get a lot, right now, working on the adolescent side, I typically get phone calls from referral sources like, you know, the community alcohol and drug, you know, provider that they're already, obviously there's already an issue. And so they're already like in outpatient services, but they keep relapsing. So they reach out to us. And after they do another assessment, they're assessed to be in inpatient services. I have parents that call, hey, look, my child is using, it's getting out of, you know, control. Please, will you help me? Yes, I will. You know, we typically, we ask for an assessment prior to admitting them.
Right.
But that's not always the case. I mean, typically if someone tells me my child's using fentanyl, you know, things like that, I will say, okay,
That's
bring
a red
them in.
flag, yeah.
Bring them in, you know, we'll get the assessment taken care of here, and then we move forward. You know, I do have parents oh, my son is smoking marijuana, what do I do? I would probably refer them to do an outside assessment versus bringing them right in. And I'm not minimizing marijuana, but, you know, sometimes if you just get outpatient services, intensive outpatient, like go 3 times a week to a group setting, you know, get some tools and stuff, they don't necessarily need inpatient.
Yeah.
But when people say the word fentanyl, meth, alcohol, typically if they're calling and it's a parent and they're already utilizing this, or this is one thing, and I hate to hear it, my child overdosed, you know, 3 times last month. You know what I mean? Yes, they need our services.
Yeah.
Because there is an issue. So, and then I just kind of go from there. I ask a few questions before I bring them in, and the process is really smooth.
If people have questions about
Anything, they can give me a call, 316-634-3954. And I'd be more than happy to answer questions about the adolescent services or even our adult program. Yes.
one more time.
316-634-3954.
Okay.